Good evening and welcome to Economics Unbound. And tonight we discuss what we are calling the great new post-COVID recovery plan of our government. This is in the making. Last week, clusters were asked by the President to go into a meeting to draft a recovery plan for various sectors of the economy. One can simply imagine the discussions behind closed doors of reconfiguring tax regimes and the way we arrange our tax system, and thinking about industry incentives for those hard-hit industries and sectors, and ramping up and redesigning our welfare system and rethinking our grant system, planning for universal access to healthcare, and reimagining that ramped down lockdown regime, negotiating debt spirals and just general debts throughout the economy, as well as loans, as well as recapitalizing health budgets and perhaps even education budgets, and so on. Good evening.
The new economic recovery plan. That sounds promising, Thandeka. And as our state unveils a new economic program for South Africa to recover from COVID-19's impact on the economy, South Africans who, by the President's own admission, love to debate everything, have started to analyze the main features of such a recovery plan. But first, there's a plan by Treasury to take an emergency or supplementary budget to Parliament to indicate the new economic priorities of our government. According to the Daily Maverick, what is becoming abundantly clear during COVID-19 is that businesses depend on a healthy society that is not subject to the brutality of inequality and poverty. This brings into sharp focus the need for a robust welfare system to buoy a very unstable global economy.
Indeed, Nana, the government's plan will be a consolidated recovery plan that at once eases the lockdown regulations and charts a way forward for the future of the country and its economy. And our economy has begun to spiral deep into the vortex of a contraction experienced never before. The easing of restrictions on economic activity is not all there is to the whole thing. There has to be a recovery plan.
So, the stimulus, and whether it is sufficient or not, is an issue. But the recovery plan stands apart from those measures. Some economists say that the size stimulus package must correspond to the anticipated economic contraction. Now, our stimulus package is in the region of 10% of GDP. This could mean that our government anticipates a double-digit economic contraction in the region of 10%. I hear that the length of time of the lockdown is also a significant factor in the amount of time it takes for the economy to bounce back and recover.
Now, good news for indebted consumers this evening. They will pay less on their debt installments. This after the Reserve Bank reduced the repo rate by 50 basis points to 3.75%. This means the prime lending rate by banks is now 7.25%.
The Reserve Bank coming to the aid of indebted consumers as the battle against COVID-19 rages on. The central bank says the easing of the lockdown regulations will help support growth in the near term. It, however, says getting the economy back to pre-pandemic activity levels will take time. It expects the economy to contract by 7% this year, worse than the 6.1% contraction forecast in April.
Monetary policy, however, cannot on its own improve the potential growth rate of the economy or reduce fiscal risks. These should be addressed by implementing prudent macroeconomic policies and structural reforms that lower costs generally and increase investment opportunities, potential growth, and job creation.
The central bank says COVID-19 has presented challenges in forecasting domestic economic activity. It, however, says job losses are expected to be widespread, as even with eased lockdown regulations, trade and investments will be hugely impacted.
The SAP has revised its GDP to a contraction of 7.0% this year. And remember, at the time of the March meeting, they expected a contraction of 6.1%. This is pretty much in line with what we expect. And going into next year, depending on how the pandemic plays out, both locally and internationally, we do expect a rebound, but it's not going to be a full rebound. So 3.8 is a very reasonable expectation.
Consumers with debt will see a reduction in the amount of money they pay on their debt.
People that will benefit from interest rate cuts are those that have credits with commercial banks, but also those that are employed, which means they can access credit, because employment is the first condition banks would require before they offer credit. But for those that have been unemployed for a very long time, I think that they will remain without access to credit. So those ones are not going to be covered, or they're not going to be held by monetary policy loosening, as we have seen. That can be done through fiscal policy.
Inflation is now expected to average 3.4% this year, and it's expected to be well within the bank's target bracket over the medium term. Gloria Musi, SABC News, Johannesburg.
Yes, and all these factors will be put into a pot and has been factored in when the modelling is done and the recovery scenarios are being mapped out. The Cabinet at a virtual meeting looked down into a looking glass and into the future of our economy and is busy hatching a plan. The President said in his own words, "We are still busy with our work," and they are mapping out what the key economic priorities for this nation will be.
Tandega, COVID is a lot of work for elected officials, but they cannot say "andidikwe man." Shh. The country's economy has hemorrhaged severely, so this is no laughing matter. Worryingly, billions of rands bled out since the 5-week lockdown to curb the spread of COVID-19, with the cost of the lockdown estimated to cost around 13 billion per day. The steroids for certain hard-hit industries must be on fleek, Tans. The International Monetary Fund, or IMF, said South Africa had not approached it for aid. IMF Director of the African Department, Abebe Selassie, said South Africa generated its financing need for the government largely domestically and its own currency relative to most emerging market countries. There are no discussions on financing with the South African government, Selassie said to the South African media last week. He also said that South Africa has always had pretty good international capital access. Over and above that, though, the country's big strength is the fact that it has very deep and liquid domestic capital markets.
South Africa will gradually ease regulations in various sectors to restart activity after the national lockdown and will work on fast-tracking some structural reforms to help the economy to recover. The virtual gathering, chaired by the President Cyril Ramaphosa, discussed progress and challenges in the implementation of the nationwide lockdown, with specific emphasis on the need for relief and social distress relief. Now, people have suffered a lot of social distress, and many South Africans who have been affected have lost their incomes and have experienced grave food shortages.
President Cyril Ramaphosa has outlined an economic stimulus and recovery plan which aims to give priority to those areas of economic activity that will have the greatest impact on youth, women and small businesses. The plan will be implemented immediately to firstly ignite economic activity, secondly restore investor confidence, thirdly prevent further job losses and create new jobs, and fourthly to address some urgent challenges that affect the condition faced by vulnerable groups among the people. The Stimulus and Recovery Plan has 5 broad parts: implementation of group-enhancing economic reforms, reprioritization of public spending to support job creation, establishment of an infrastructure fund, address urgent and pressing matters in education and health, investing in municipal social infrastructure improvement. South Africa restored investment and exploration levels in the mining sector as mining and mineral beneficiation activities have significant potential to drive long-term growth, exports and job growth. This will revitalize the mining industry and provide certainty to investors while charting a sustainable path towards a transformed and inclusive industry. Ramaphosa added that Parliament would be requested not to proceed with the Mineral and Petroleum Resources Development Act Amendment Bill, given that it has contributed to a lot of uncertainty in the sector. To reduce the cost of doing business, boost exports and to make South African industry more competitive, government has begun a review of various administered prices, started with electricity, port and rail tariffs. Reprioritized funding will be directed towards investments in agriculture and economic activity in townships and rural areas. Agriculture has massive potential for job creation in the immediate and long term. The intervention identified will include a package of support measures for black commercial farmers so as to increase their entry into food value chains through access to infrastructure like abattoirs and feedlots. While the restrictions first halted all economic activity except essential services, cooperative governance, Minister Nkosazana Dlamini Zuma announced that mines can resume work at 50% capacity. Prudence Makubalo, SABC News, Johannesburg.
Over the past few days, we've been in consultation with various stakeholders. We've met with business, labor and community constituency in Nedlec. We've met with our premiers, MECs and metro mayors, and with the members of the Presidential Economic Advisory Council. Following these meetings, Cabinet considered various proposals and finalized the social relief and economic support package that stands at the center of the second phase of our economic response. This involves, firstly, an extraordinary health budget to respond to the coronavirus pandemic. Secondly, the relief of hunger and social distress. Thirdly, support for companies and workers. And fourthly, the phased reopening of the economy. The impact of the coronavirus requires an extraordinary coronavirus budget of around 500 billion rand to direct resources towards fighting the pandemic. This will include the reprioritization of around 130 billion rand within our current budget. The rest of the funds will be raised from both local sources, such as the Unemployment Insurance Fund, and from global partners and international finance institutions. To date, the World Bank, the International Monetary Fund, the BRICS Bank, the New Development Bank that is, and the African Development Bank have been approached and are working with the National Treasury on various funding transactions. Some of these institutions have created financing packages that are aimed at assisting countries that are having to address the coronavirus crisis like us. This funding will be used in the first instance to fund the health response to coronavirus. An amount of 20 billion will be directed towards addressing our efforts to this pandemic. If we are to successfully manage the anticipated surge in cases and ensure that everyone who needs treatment receives it, we must provide for additional expenditure on personal protective equipment for health workers, community screening, an increase in testing capacity, additional beds in field hospitals, ventilators, medicine, and staffing.
Now, NEDLAC views level 3 lockdown as an opportunity for expanding local production and greater consumption of South African goods by consumers as a part of reversing the economic losses suffered during the national lockdown, and as part of the program to revitalize the industries of our country and create employment. Now on Skype, we are joined by the CEO of NEDLAC, Lisa Seftel. Lisa, hello.
Hi.
Thanks for joining us.
It's a pleasure.
Now the President says that you've been meeting. What have you been talking about?
NEDLAC has been meeting since the beginning of this COVID pandemic to do a number of things. The first is really the immediate response, the emergency response, particularly around providing relief to workers, and increasingly also to look at health and safety protocols, so as the economy is opened up, that workplaces will be safe to go to. Yes, there's also been discussion and consultation with the President about economic recovery, and as you indicated earlier on, there has been a call from both business and labour that there should be a focus on local production, particularly around issues like the cloth mask. There's an initiative around ventilators, sanitizers, and so on.
So what will be the main features of our recovery plan as a nation?
I think you extensively quoted or showed us President Cyril Ramaphosa, and I think he's set out really what he sees as the key pillars. And really, in the coming months, we hope that in NEDLAC, there will be concrete discussions about how to take some aspects of that forward, and in particular, to be able to get contributions and joint working together between government, business, labour, and the community constituency.
Now, who and what is NEDLAC, and why are you so important?
Well, NEDLAC is a National Economic Labour and Development Council. It's been around since the dawn of democracy. In 1994, it was one of the first institutions established post-apartheid. And at NEDLAC sits representatives of organised labour, organised business, community constituency, and government, with a particular focus of government from the Department of Employment and Labour, Trade and Industry, and the National Treasury.
Now, the Minister of Health said today that we are all involved in a people's war on this pandemic. We are involved in a war to defend our health, but we are also involved in a war to defend our economy and our livelihoods. On the economic front, what would you advise households to do?
Well, I'm not really sure that I'm the one to be advising households. I think households are in a very fragile state, many households, due to the lockdown and the fact that the economy is opening slowly. What I can say is that there have been relief measures negotiated at NEDLAC, the most prominent one being that of a special benefit called COVID-19 Temporary Employment Relief Scheme, which is available to all employees, and that it is available either through employers, and more recently, employees are able to apply directly. And as I understand, the Minister is also looking to be able to make sure that if a worker's employer has not contributed, that they should not suffer, and they could also be eligible to get this benefit.
Are you considering further relief measures for the vulnerable in our society?
There is some discussion in NEDLAC, an increasing discussion, as we all begin to realize that after the 3-month period to the end of June, when the disaster is not meant to be lifted, there will still be significant hardship. And that there are certain sectors, for example, like hospitality, that will need a much longer time before they're able to operate normally and begin to serve customers. Tourism is another example as well. This is a very sobering and difficult situation that the social partners are facing.
One of your social partners, and that is NGOs and community organizations, had a very disturbing chat at NEDLAC, we understand, where they're saying that their own financial support is beginning to fray. And they are the people that the communities rely on to champion their issues, especially in a time of trial such as this one.
Unfortunately, I didn't hear your question.
Can I repeat it?
Sure, yes.
I read that community organizations and NGOs are reporting that they are also experiencing some funding backlogs of their own organizations, and this is hampering their efforts to provide much needed relief to communities in distress.
Yes, that is true. Everybody is badly affected, and there was a plea from those community organizations to engage with the Department of Social Development to see whether they could also get some support. They also indicated the important role that they've been playing in communities, doing activation, assisting in screening and tracing, being able to identify vulnerable people who need food parcels. And they felt that that role should be recognized by government and that they should be supported.
What are businesses telling you inside NEDLAC? What are they going through?
Businesses are, well, let me just say that we also, we hear the leadership of business. The leadership of business have come together between BUSA and the BBC, or the Black Business Council, and they have really done a lot of work analyzing the economy, looking at the impact and developing different scenarios. And they're hoping that these scenarios that they're developing will enable them to have a more data-driven approach and a more informed approach to be able to work out where relief needs to be concentrated, as well as where there are opportunities for growth as the economy opens up. Individual businesses feel very stressed. I think anybody can tell you that, and are very anxious about being able to come back to work, but also very anxious about what will happen if, for example, somebody with COVID-19 is at the workplace. And that's why in NEDLAC, the social partners are putting a lot of attention to ensuring that there are clear health and safety protocols in place, and also to try and make sure that workers can be as safe as possible when they do return to work, especially those that interface with the public.
So these sectoral groups that are having discussions about how lockdown 3 would pan out, how many are there and how are they divided?
Well, obviously there's different kinds of ways in which they're divided, sometimes sectorally, sometimes in terms of value chains. For example, the construction sector at the moment is very keen to get back to work, and they have been negotiating and discussing with the Department of Employment and Labour a special health and safety protocol that would apply to them.
Yes, I can imagine, because the construction work cannot happen remotely. You can't build a house remotely, you have to be on site.
Absolutely.
But I interrupted you.
No. So the construction is one. I think the public matter has seen also the motor industry is another industry that has looked at ways and means and negotiated with government how to come back. And then obviously the mining sector is a big one, very important. And in the mining sector, there's obviously a risk because people travel all the way from around Southern Africa to come back. And we don't want that, or they don't want that, to lead to an increased spread of the virus to places which previously were less infected and affected.
Thank you very much for joining us, Lisa Saftel, CEO of NEDLAC. Now, South Africa's Agricultural Disaster Fund is set to hand out over 500 million worth of support vouchers. This will be given to more than 15,000 farmers after Agriculture, Land Reform and Rural Development Minister Thoko Didiza said more help was on the way for the sector.
while the country has endured more than 7 weeks under the national lockdown, which began in March. Several businesses have taken a massive knock or have had to close down their operations. This includes sectors such as agriculture, which feeds a majority of the country despite only making 1% of GDP. Although the sector remained essential and uninterrupted amid the lockdown, which hindered much trade. Delivery interruptions and lower sales have been a blow to food security and the sustenance of millions. It is because of this that farmers are in need of urgent financial support. While government has placed a 1.2 billion rand package to aid sustainable food production aside, the effects of COVID-19 may last long after the pandemic has subsided. Agricultural Minister Togo Didiza announced a 50,000 rand relief payment that will be distributed to over 15,000 farmers to continue with their farming.
15,036 applications have been approved with a value of just over 500 million in favor of smallholder and communal farmers. The work will be completed in terms of releasing the vouchers to the various applicants who have been successful.
Didiza has urged farmers that were not successful with their applications to seek other governmental interventions which may still be available.
I would like to urge the farmers that have not been approved that they shouldn't lose hope. We will be working with them with other departmental interventions, particularly in our provinces and at national level. We're also going to seek partnership with other non-government bodies to look at how best we can support our subsistence farmers.
The minister has also insisted that farmers who could not submit their applications on time due to various reasons or challenges must not despair. Government has put in place other departmental programs to reach as many farmers as possible across the country. Notando Magutulela, SABC News, Johannesburg.
Agricultural sector ranks amongst the best in the world, and it's over the years has demonstrated high levels of resilience, but the impact of COVID-19 on the sector is expected to run into tens of billions. 2020 was actually supposed to be a recovery year for the agricultural economy, following years of sustained drought and disease challenges, but then COVID-19 struck. So while most of agriculture was allowed to continue with production activities, challenges remained for a number of agribusinesses within the value chain. In certain commodity groups, for example, wool and mohair, as well as, of course, the wine industry, the negative impact was felt on the ability to produce and sell, as well as on the demand generally, both locally and internationally in terms of the export market.
While dealing with the economic recovery plan, South Africa has registered its own clinical trials for a vaccine or treatment for COVID-19. A clinical research organization in Cape Town is leading the initiative. The first healthcare worker has been administered BCG, a vaccine that's been used to treat tuberculosis since 1921.
South Africa is playing an important role in what could be one of the most momentous scientific breakthroughs in history. President Cyril Ramaphosa has hailed the country's research initiatives in the development of possible preventative treatment or vaccine for the virus. He's called for continental and international collaboration in doing so.
South Africa is participating in several research initiatives. We must ensure that there is equitable access to medical equipment, technologies in all respects. In this final decade towards the attainment of the Sustainable Development Goals, we must press ahead with our goal of making universal healthcare a reality for all the people of the world.
Task, a self-funded organization for clinical trials, has injected its first healthcare worker with BCG, a vaccine used to treat tuberculosis in children. A minimum of 500 healthcare workers have been invited to participate in the clinical trials. The reaction to the drug will be closely monitored, and if there is a robust enough positive signal, the results will be made public.
There have been indications that the vaccine might be doing more than just protecting children from severe forms of TB. There have been reports about various protective effects that this vaccine can have, and studying all this evidence, we have thought that it might actually work for COVID-19, but obviously there is no data for it. So we are doing this trial, and we have decided to offer this to people that are particularly exposed to risk, which at the moment is healthcare workers in the big hospitals. And we are inviting them to be vaccinated either with this vaccine or a placebo. And then over the next 12 months, we will follow both of these groups and see if those that receive the vaccination perhaps do better during the epidemic. If our study suddenly showed evidence that everyone at risk of COVID-19 should be vaccinated, we need to be very conscious about the stock of this vaccine and the production that would have to be increased. It is not an expensive product. I think it's between 10 and 20 rands a vaccine, so there is certainly not a huge commercial interest in it. There would be a public health interest in it mainly.
Although clinical trials are underway in South Africa, it may take up to 18 months before a vaccine is developed. Even then, there are some clinical protocols that first need to be observed.
There are something like about 5 or 6 clinical trials in South Africa underway right now. One is of a BCG vaccine in healthcare workers. There are 1 or 2 trials of chloroquine or hydroxychloroquine. And there's the big WHO Solidarity trial. That is a 5-arm trial that's being done in many countries, including South Africa. So those are among the trials I am aware of. I know that discussions are underway by several groups to look at participating in yet more international clinical trials. I have not, at this stage, seen trials that are purely South African and are completely new ideas. I guess closest it comes to is the BCG trial, but that's not new. Actually, that's being done in Australia. So I don't think we've really seen that. But I think, I keep saying to everyone, you have to understand, we've only known about this virus, for 4 or 5 months.
While scientists work tirelessly to make a COVID-19 vaccine available in the near future, the reality is it may take years for a cure to be found. In the meantime, we're urged to wash our hands, sanitize consistently, and maintain social distancing. Notando Makutulela, SABC News, Johannesburg.
Now on Skype, we have Saul Levine, and he's the director of the Trade and Industry Policy Strategies, which is an advisory service to the Department of Trade and Industry. And he joins us now because I think he can offer us a bird's eye view of the South African economy. Welcome, Saul. Welcome back to Economics Unbound.
Thank you.
It seems to me that there's a two-pronged strategy emerging. One is to completely recapitalize and improve our health infrastructure and participate in clinical trials on one hand and fund that. And on the other hand, to get industries ramping up and going slowly while watching all the protocols and observing that. Is this right?
Yes, we need to be thinking about the health implications of the crisis. And we also need to then think about how do we open up the economy in a way that's safe for people. We don't want to see workers getting sick in the workplace. So all of these things need to be looked at and considered in how we open up. So what we are at risk of, though, is that the retail sector, the services sector, the tourism sector, and similar public interfacing industries are going to be at huge risk going forward. So even if there was no lockdown, we would be at risk of those industries not seeing the kind of customers that they used to, because people keep socially distant or physically distant from going into those kind of spaces. So we then need to be thinking about what new types of industries should we be taking forward.
Now, you're in the policy space, and you must probably feel like you're standing poised at the threshold of a new policy landscape. You have to draw policy for uncharted waters, for unforeseen emergencies. What is going in your mind about all of this? What do you think we need to do?
So one of the things that was being pushed in the last year and a half has been the industry master plans. And what we really need to be looking at is how do we reconfigure these master plans to start driving industrial development a lot harder. So to think about, not just talking about some of these measures, but really starting to push very hard, putting them, as some people have said, putting them on steroids and saying, let's really, really make this work for South Africa in terms of how do we grow our industrial base. And think about industries that aren't as public interfacing as those that are going to be at risk for the next 12 months or so until there's a treatment or a vaccine. So we need to be thinking about driving industrial development a lot harder as a way of creating employment and as a way of driving growth for the economy in a way that we haven't done in South Africa in the past. So much, much more resources and energy going into how do we get manufacturing as a core industry thriving in South Africa.
Now, which industries are going to be ramping up during lockdown 3?
So what we are looking at is opening up in a whole range of manufacturing sectors. So we will face the problem, though, that if not all of the sectors open up, then the manufacturing firms that supply them will be constrained. So, for example, if you don't open up the liquor sales, then the bottling companies and the glass companies and the people that do the caps can't get into full production. So there's a whole range of things that normally open up together. So we would look at the whole value chain. But really what we've been advising and what we've been saying is the importance of, firms that aren't customer interfacing opening up a lot quicker because they can put in the safety measures and they can do all of the necessary protocols to keep their workers safe. Where government does need to play a strong role is in ensuring that the transport to the workplace is safe so that workers don't bring COVID-19 into the workplace, because then as a worker you're at risk and no one really wants that. So what is important is how do we quickly get firms operating and safely operating. So what we've already seen, and we've had some engagements with people in the meat industry and poultry industry who have put in a lot of extreme safety measures because of what's happening overseas, where there's been a lot of outbreak there in those types of industries. So we're fortunate in South Africa, we can see what's been happening globally, and then we are able to react and put in the necessary safety measures to make sure that workplaces are safe.
Are we still following the Chinese example and the Chinese model? And what have we learned about the reopening of an economy?
I think we're learning from a whole range of different countries. So the research that we've done and which we've shared with government is on a whole number of different countries and what they've all done in order to open up their economy in a way that doesn't allow the pandemic to spread. Because at the end of the day, even if there wasn't a lockdown, if the pandemic became so endemic in society, people are going to voluntarily stay at home because they don't want to go out and get sick or run the risk of catching the disease. So the lockdown then becomes voluntary rather than state imposed. So what we really want to do is make sure that the way we open up doesn't allow the disease to spread. So very strict control, as the government has done, on wearing masks, but also being a lot more cautious on public interfacing industries. So what we will see is those types of industries being a lot slower to open up. And even after we get to level 1, I think people as consumers will be very, very wary of going into spaces, particularly confined spaces, where they might be exposed to COVID-19.
Saul Levine, the head of TIPS, joining us there. Thank you very much for joining us.
Pleasure.
Now let's take a short break. Now online, we have Professor Peter Bauer from the University of Johannesburg School of Economics. And he'll help us understand what could be in the mind of government and what could be the design of an economic recovery plan. Good evening, Peter. Thanks for joining us.
Good evening. Thank you so much for inviting me.
And what is in the mind of government in your view?
Okay, right. The big strategy right now is to stimulate our economy and try and catch up with the rest of the world as the rest of the world starts to come back into a growth cycle. So we're probably going to see most of the other developed economies and developing countries starting to move more towards increasing levels of output and productivity, and in which case we're going to want to go with that. In order to do this, we need to stimulate businesses within South Africa, so we're going to probably see a bit of fiscal stimulus coming along. In other words, well, at least monetary stimulus. So we're going to be dropping your interest rates a little bit to try and stimulate investment within the country, and then you're going to be seeing fiscal stimulus more on the social grants, trying to stimulate packages, household
Peter,
packages.
you mean another tranche of stimulus?
Yes, we'll probably have that happening. The reason is because we have to drive that economy, we have to drive that growth. We have to really inject this economy to get us back up again.
So how big do you think the looming re-injection of stimulus will be?
Okay, I can't give you a number right now. That I really can't. But we've got to just take a look at what we really are faced with. If you consider the very high levels of unemployment, the growing inequality, and the absolute poverty we're experiencing, and obviously the post-COVID-19 impacts of where we're sitting with all these problems, there's going to be a vast amount of motivation required to drive this economy. It's not going to be enough to drop the interest rate, so we're going to definitely see more money being pumped into the economy. The challenge, and of course, perhaps hopefully alleviating some of the taxes on businesses. But the problem is there's a limit to how much money we can actually gain.
And will this additional stimulus be announced before or after the Minister of Finance goes to Parliament to announce the budget, the new emergency budget?
Well, your minister, when he goes to Parliament, he will definitely, in Parliament, he will definitely release his ideas. I don't think he's going to give us much information beforehand, so that's going to be a lot of speculation. But there is definitely going to be a drive to try and re-encourage investment and business confidence once again.
Now, the final question is, do you think that we have a huge and enormous new opportunity to reimagine an economy and to remake it, to design it in such a way that we deal with inequality, poverty, and the social divisions we have?
Yes, we have to take that very seriously, and hopefully with some of the funds from the IMF, we'll be able to do that. Our big problem right now is we do, and the realities are, we're in heavy debt. We've got a huge debt to GDP ratio. We are sitting with very low levels of investment. We've got international communities have really questioned our policies to date. We've been downgraded many, many times, and these are all realities. And we're going to have to do some really hard work to bring us back into that international community and to win their confidence back.
Thank you for joining us tonight. That's all we have time for. Goodbye, and thanks for joining us on Economics Unbound.